Earlier this week, the Health Ministry said it's diversifying its sources of COVID-19 testing resources as it increases the rate of testing in Singapore. Singapore gets its test kits from three main sources: local companies that can produce such kits, research partners like the Agency for Science, Technology and Research, and other parts of the world such as China and South Korea.
But even as testing intensifies, MOH said that all laboratories in Singapore conducting coronavirus tests will be issued advisories detailing the processes they should follow. The move follows the ministry's announcement over the weekend that 33 false positives had been detected as a result of an apparatus calibration issue.
We want to help our viewers and readers understand the process behind testing for COVID-19. So we're pleased to have Dr. Ong Siew Hwa joining us now. She's the Director and Chief Scientist at biotech firm Acumen Research Laboratories. Now, she told the Straits Times last month that Singapore is in a good position to do mass testing. Hi, Doctor. Now, Doctor, if you could walk us and our viewers through the testing process, from how the test is done on the ground to the lab and the generation of the results.
Yes. Hi, everyone. Good afternoon. It's my great pleasure to be here and sharing with you about testing of the COVID virus. So the process essentially starts with the sample to be tested, being collected, and that's usually the nasal swab or the throat swab. So this sample is then put into a liquid called the viral transport medium and is brought to the lab. And once into the lab, it will go through three processes. Number one, heat inactivation to inactivate the virus so that it will no longer be infectious. From that sample, the RNA, which is the genetic material to be measured from the virus, will be isolated. This is called the RNA extraction. It is usually automated because there are a lot of samples, and in order to have the steps consistent, automation helps. From the extracted RNA, it should be as high quality as possible. It goes on to the next step of the real-time PCR, RT-PCR. And in this process, the amplification of the genetic material will take place. And this takes about 1 to 1.5 hours with the PCR machine. The data generated will then be reviewed by the medical director of the lab and will be generated and signed off. And positive samples will be tested again at another central laboratory to confirm the results. Yes.
Dr. Ong, 33 false positives were previously detected as a result of an apparatus calibration issue at an unnamed lab. So what other things to look out for to avoid false positives, false negatives, and any inaccurate results?
Yes. A PCR test is a very sensitive test. Any little bit of contamination can result in false positive or false negative. So it is important that the lab environment is very clean, and the staff, the lab staff that are doing the tests are all taking the precautions. So that's number one. Number two, it is also the equipment. Indeed, the calibration of the equipment is important. Some equipment need to be checked and calibrated daily. Some other periodical maintenance and calibration, like monthly, is good. Yeah. So it is also about the QC processes that are in place in the lab, the quality management. So all the SOPs, the training of the staff to perform the test with the best of their competence, and all the reagents are also of the good quality. Nothing is expired, for example. Yeah. And in terms of the role of the medical director who's reviewing the data, some of the results could be in the ambiguous range. So the decision on making a call, whether it's a positive or negative, is important to be validated. Yeah. So, for example, run another test if there happens to be a sample whose result is right at the borderline. So all these are about the QC. Yeah.
The Health Sciences Authority said it's expediting the approval of 40 plus test kits, which can now be approved in about 2 months. Dr. Ong, are there any pitfalls to this approach, though? For example, does it mean quality could vary across kits because there's less time for validation?
Yes, the urgency of having test kits in this situation of the COVID pandemic demands that they are approved on a fast track. So in Singapore, the US, in Europe, everywhere in the world, most regulatory agencies have a fast track for COVID tests. So despite this, I feel that the review process, the criteria for approving a test were not compromised. So mainly all of these regulatory agencies have a list of criteria which is called the analytical validation. It ensures that the test would perform with a certain specs and parameters that will make it robust. So I think despite the fast track, it is still a very robust and comprehensive review process. Yeah.
Right. Well, thank you so much, Dr. Ong. That was Dr. Ong Siew Hwa, Director and Chief Scientist at Acumen Research Laboratories. Thank you so much for your time once more and for explaining to us the testing process as we continue our fight against the coronavirus.